Hi, I'm Chet Kolley, Senior Vice President and General Manager of Medical Technology and Healthcare Business Unit at GlobalLogic. I'm based in San Jose, California, and I've been with the company for almost 10 years now. I'm happy to be here in Noida because it's where the foundation of the company was about 15 years ago. And GlobalLogic is a global software R&D services company. Our main mission is to help our clients get product to market faster and more effectively than they could do it themselves, and to help them capture new revenue streams. So GlobalLogic has been doing software development on Class 2 and Class 3 regulated medical devices for over 10 years. And we have a very evolved quality management system and have been doing sophisticated medical technology work, software work, on medical devices and healthcare systems for that duration, for 10 plus years now. And our expertise really falls into three subsegments. One is medical technology and devices themselves, healthcare software and systems, and also life sciences and pharmaceuticals. Medical technology is being transformed by and change in business models and some major innovations in software and technology. For example, innovations in both sensor technologies and core medical device technologies is enabling devices to do more and more sophisticated things, as well as being less burdensome on a patient. They're more transparent to a patient's use. And on technologies like, say, smartphones. When you think about it, most of us walk around today with a computer in our pockets that's more powerful than some desktops were, say, not that long ago. So the combination of tremendous transformation technology in the devices plus the computing systems that surround those devices allow us to do more dramatic and life-transforming things to people who have diseases. Software is doing some really interesting things. Number one, organizations want to be more in touch with their end users. So medical device manufacturers and healthcare providers want to have deeper and more meaningful engagements with their patients. And software systems really is what makes all this possible. So it makes it more available for a patient to engage directly with a care provider via a software system or a smartphone. And the other is on the devices themselves. When you think about how, for instance, someone with a diabetes condition can have an insulin pump that's driven by software that can, in the not too very distant future, create a situation where that artificial insulin pump can almost approximate how a pancreas itself would operate. And that's really transformational to people who have diabetes. Other segments that I think are really being transformed by software is cardiology. So when you think about how populations in the healthcare segment are being managed today, just for instance in the US, where I'm based, almost 50% of the adult population have at least one chronic condition. And of those, 20% of that 50% has more than 3 chronic conditions. And oftentimes it's things like diabetes or heart conditions, something affecting really their entire body and their life as a whole. And the ability to gather data and information from various sensors, from devices, is really impactful in helping people to live meaningful lives and take care of those chronic conditions and give them the information that makes it more possible for them to care for themselves. So other systems where software is a major component, for instance, is defibrillators or pacemakers, and the ability to make those devices function almost with a pacemaker It can extend someone's life longer than they would have without a pacemaker. With a defibrillator, you might be able to truly save someone's life in an acute situation where if the defibrillator wasn't there, they would pass away. They wouldn't be with us anymore. And the ability to make these devices interact directly with the human body and then gather the information and put that information in front of the physician or the caregiver to make life-changing or life-extending decisions and helping people to regain their health. We work with a company that's very deeply involved in the hearing loss market and actually restoring hearing capability in someone who has no hearing capability. Software and technology has allowed these devices to become smaller and less intrusive, and the software can help make these devices create an experience for the patient that most closely approximates natural hearing. So software is really behind all these devices that we rely upon to make our human experience be as natural as it can be and as rewarding as it can be. As I mentioned previously, GlobalLogic's been doing regulated medical software and medical technology work for over 10 years. We've been doing work on Class 2 and Class 3 medical devices. These are the kind of devices that are involved in the saving of life and limb or the loss of life and limb if not done properly. So GlobalLogic has a quality management system that is certified for doing this work on Class 2 and Class 3 medical devices. From our focus purely on product engineering and R&D services, we've been deeply involved in the actual development of medical devices for quite some time. What that means is that we have the inherent knowledge within the company to do more and more sophisticated work on medical technology, medical devices, and healthcare. It really is a virtuous cycle in that the deeper expertise you have, the better you are at attracting the best talent in any market to join the company and to continue to make that expertise even deeper and broader into adjacent markets. As a company, GlobalLogic is focused purely on product R&D services. That means that we're doing the work for our clients to help discover what products it is or what services it is that they should build or should bring to market, as well as actually helping build those products and services, bring them to market, sustain them in the market, and help to make them successful. For instance, one of the things that we do in the medical technology business unit is that we maintain our own innovation lab. And we get ideas from our innovation lab by working with existing clients and understanding what is on their product roadmap. What innovation ideas that they have maybe 12, 18, 24 months down the line? What does their long-term product vision look like? Or working with folks that maybe we don't even do business with today, but we really see value in working together and partnering with them, and we want to capture their business and show that we understand their segment very well. And then lastly, I'd say from participating really closely in various industry events, we look to use our innovation lab to show that we are very well regarded in the industry, that we understand the industry, and we have some really great innovative ideas on our own, and we build little pieces of technology to show off our point of view and the fact that we have really great technical leadership within this company. Not products for the market, just to show off a little bit of our ideas and skills. GlobalLogic has been in this market segment for over 10 years, and we do things as varied as I mentioned earlier, building an application that a technician would use to tune a hearing implant, for instance, to the applications that are used in managing a pacemaker and how it operates and the information that you gather from it, to some of our more recent offerings with partners is helping a company engage with elderly market segment by creating a really innovative solution that helps grandparents engage with their grandchildren over a technology platform like a tablet that can be also used to help them take better care of themselves or to integrate with medical devices that they happen to have in their home and keep track of them and making sure that they're living healthy lives. And there's all sorts of other innovative ideas, great market segments out there that we're looking to address. For instance, Alzheimer's, how to use innovative sensors, some low power required communications protocols and software systems to take care of people who, as they advance in age and have these illnesses, can't take as good a care of themselves. And with our worldwide population becoming more mobile and maybe having less extended families, being able to reach out over time and space and make sure our loved ones are in good health and in good physical condition, it's a great thing. India is a place where we've been doing, as I said earlier, it's where the foundation of the company is, where we've had an office for over 15 years. We're doing some really interesting things here in India on medical technology, healthcare systems and medical devices, working on hearing loss systems. I think one of the really interesting projects that we're working on is helping a company use Android technology, where we have had experts since Android first came to the market, and using that core technology, which previously was primarily focused as a mobile communications technology, and use it in a medical technology and in a healthcare environment, and have a medical device that's actually Android based. It was a really great application of core, sophisticated and solid engineering talent that we have here in India, and applying it to a medical technology and healthcare market for the benefit of people and keeping them healthy. Things have changed so rapidly just in the last 2 to 5 years. The things that I see coming that are going to be truly transformational is the sensors that are used to gather information about ourselves and our conditions and maybe disease conditions. They're going to be getting smaller and smaller. They're going to be more transparent. They'll probably be disposable, where you just stick a patch in a couple of places on your body and it gathers information, and using very little power transmits it to some device or something that gathers that information and sends it to a place where great insights can be gathered from that information to help us take care of people and recover from diseases and manage our conditions more effectively. Imagine that you have sensors wherever you could possibly want to put a sensor. Now it's tough to put a sensor everywhere or it has been because of their form factor and power requirements. Well, if you have these little disposable sensors that you can pretty much put anywhere, we can gather just about any information that we want to gather. And then we can use sophisticated software systems and analytics to find out really interesting things about that information. Things like knowing amongst the populations of patients which one a remote nurse should go visit today and take care of, and which people are doing just fine on their own. And learning how disease progresses more effectively by being able to analyze it and have more data points on it. And then just generally gathering tremendous insights that will help us manage massive populations and I think over time better manage disease and the allocation of scarce healthcare resources, making sure that the people that really need it get it, and that we all are more effective at taking care of ourselves because we know more about what's happening with ourselves and our bodies. And I think, lots of data, lots of information, and lots of understanding about who we are and how we work is going to happen in a not too distant future.
So the body can be monitored through the sensors?
Of course, yes. Think about, like what we know about DNA today, that just not that long ago we knew very little about. The same thing is going to be happening about, disease progressions and how our body works, how we fight off disease, how we repair ourselves, how we take better care of ourselves, those kinds of things. The interesting part of that question is doctors can be anywhere, right? For instance, today we have a system that is part of a defibrillator system. Someone has a heart attack and they're dying, right? And you use the defibrillator and they get shocked and their heart starts beating again and they're being brought back to life. And we've built the systems and managed the systems that take that information from that patient and send it to the hospital so that by the time the patient gets there, the team at the hospital is already prepared and ready to go and work on this person and make sure that they're well cared for and maybe completely save their life. And at the same time, if there is an attending physician that should see that information and that waveform from their heart, that's sent to them wherever that doctor is. I think one of the big things, another big thing that's going to happen over the next several years is the further evolution of, you hear this word called the Internet of Things, or this term, the Internet of Things, the Internet of medical things. That's really going to make less important time and space. And what I mean by that is we'll gather information and have sophisticated analytics that will be able to recognize situations that need some kind of intervention one way or the other, or maybe they need no intervention, but now we know it. So we'll have the systems to gather the data, do the analytics, and in a short period of time, tell us to do something or to do nothing. So that's really going to be crunching the time, right? Making time less important. At the same time, we have these great communication systems and the ability to send tremendous amounts of data in really impactful ways to someone wherever they are on whatever device they happen to have, wherever they might be. That reduces the importance of space. So making time and space a little less relevant in the delivery of very sophisticated, life-changing healthcare is something that I think will be really apparent over the next couple of years. If you think back to before Apple created the iPod, we struggled with these MP3 players, most of which didn't work all that well. I mean, you can make them work, but you really struggled with them. I think someone's going to come up with a breakthrough in the wearable space that's going to be like Apple did in the portable wearable music space, several years ago. I think in the next couple of years, you'll see someone really crack the code in the wearable space, and it'll be, wow, this is the wearables company. In the future, doctors are probably going to have to work and adjust how they work compared to how doctors have in the past, because they're going to have vast amounts of information that they'll have at their fingertips. And I think if we do things right, we'll be able to make better use of doctors' time so that they truly have as unambiguous information as possible to help make life-changing or life-saving care conditions at their fingertips. And that's not something that was readily available